Hey everyone, preparing for IVF, we look at a lot of different factors, and we want to focus really specifically on, what are the modifiable things we can be doing before an IVF to improve our success rate. I think that's the number one thing that patients have on their mind when they show up in our office for a consult, or when we're seeing them for a video consult. And it's a very important thing to discuss because what we've seen over the last 2 decades is your IVF success rate is considerably modifiable or can go up and down based on a lot of lifestyle factors, dietary factors, different micronutrients. And today I want to focus specifically on the microbiome. And this is an area that's fairly new, related to fertility, and it's gaining a lot of traction and newer studies. And it's a new, exciting avenue, where we're looking at new therapeutic approaches to improve fertility and improve things like IVF pregnancy rates. And it seems like, our previous belief was that the endometrium and the uterine cavity was actually a sterile environment, so no bacteria should be present. But what we've seen slowly over the years is we actually have populations of different bacteria, and either for better or worse, they are going to impact our pregnancy rate, the miscarriage rate, and the implantation rate with a treatment like IVF. So it's only, makes sense to use this to our advantage on how can we optimize our microbiome to really support hormone production and support a healthy environment in the uterus that is conducive to implantation, a healthy pregnancy, and to reduce the risk of something like miscarriage. And that's, I think, a very exciting avenue on what we can offer for patients. So particularly what we've seen is that the species of lactobacillus, this type of bacteria should usually be dominant in its population in the uterine cavity. And this is very beneficial because lactobacillus during pregnancy seems to reduce inflammation. It makes it more tolerant to the changes that can occur with the hormone increases of pregnancy associated with pregnancy and still maintain a healthy environment for the baby for pregnancy. And what can happen is we can develop something called dysbiosis. So it's a deviation where we move away from this healthy, balanced, lactobacillus dominant population into where more pathogenic, species or bacteria start to concentrate and populate the uterine cavity as well. And this can increase rates of inflammation and make it less receptive for something like implantation. So based on a new review that was published recently this month, we looked at some numbers to actually elucidate what is that difference. And the numbers may actually surprise you because they very much surprised me. And basically, when we have an environment that's dominant in this lactobacillus strain, we see that the likelihood of implantation after fertility treatment is almost triple compared to patients where we're seeing there's not a non-dominant lactobacillus population. So we're seeing other pathogens there as well. And this is quite significant because, in addition to the implantation rate, we're seeing that the clinical pregnancy rate, so how many of those patients will actually go on to have a positive pregnancy test, a healthy ultrasound, it was almost a double. I think it was something like 70% of patients that had a healthy uterine environment with a healthy bacteria, to patients where they had a more diverse microbiome in the uterus and less of the lactobacillus, was only about 33%. Only 33% of that group went on to have a positive clinical pregnancy rate. And most importantly, I think this is the group of patients that it seems to impact the most is potentially miscarriage rates. And basically, the numbers were the most drastic, numbers we've seen in terms of what it was for the healthy population and for the unhealthy population. And basically, if you had an unhealthy or dysbiosis, present in the uterine environment, the risk of miscarriage was up to 70% in this group. And if you had the healthy uterine environment with a lactobacillus dominant environment, the miscarriage rate was approximately 7%. So we're talking about a huge difference, and the only difference we're seeing between these groups is really the type of bacteria present in the uterine cavity. And so that just comes to show us how important, this microbiome may be when we're planning for a treatment like IVF, and how we can use it to our advantage. Imagine going into a treatment like IVF where you're not aware of this, you haven't addressed this, and it may work, may not have an impact on your success rate. It may lower your success rate or it may improve your success rate. But if we do, address this, 2 to 3 months before a treatment like IVF, we can potentially use it to the advantage, to try and have a better success rate, a better implantation rate, and potentially a lower miscarriage rate. And it's really important to mention that dysbiosis is present in 20 to 50% of the time. There are no symptoms. So you may not have any symptoms of having this dysbiosis, this unhealthy distribution of bacteria in the reproductive tract and in the uterus. And so the classic symptoms usually we look for are, there's a clear discharge, excessive discharge. It may be odorless. Sometimes it's a bit of a color discharge and may have some odor to it. But 20 to up to 50%, so about half the time, this may be present. You may have no symptoms at all. So if you are a couple that's been having implantation failure, if you're a couple has unexplained infertility, or if you had recurrent miscarriages, this is potentially an important thing to look at and address. And so case by case, depending on symptoms, history, your current situation, sometimes it's crucial to give some type of antimicrobials or antibiotics to clear up these infections or bad bacteria. And in many cases, we use probiotics, a lot of these healthy strains of bacteria, to help populate and repopulate the reproductive tract. And it's important to mention that even oral probiotics, can have such a big impact on fertility, because the gut microbiome, if it also has dysbiosis, or if we have an unhealthy balance of these bacteria, we can start to see increase in inflammatory rates. We can see poor insulin sensitivity, poor glucose control, and a shift in the immune system, which may make it less optimal to support something like pregnancy and implantation. So the gut microbiome has a huge impact, and especially on the hormone balance. So our gut microbiome has a huge impact on our estrogen levels, our hormone metabolism, reabsorption, or hormone excretion through the bowel movement. And if the hormones are imbalanced as a result of the gut dysbiosis, that on its own can affect negatively the reproductive microbiome. So it's important to address the reproductive microbiome, but also the gut microbiome, as it can have a huge impact on fertility outcomes as well. So if this is something you've been suffering with, or you've been having difficulty with fertility, this is really something important to look at beyond just, well, let me just have some yogurt and pop whatever probiotic I can find. And if you want to talk about this in much more detail, please get in touch with us. Feel free to drop a comment here, send us a message in our inbox, or email us, and we can always connect. And if you have any questions, I'm always happy to answer.